The following program is brought to you by Cloudcast Media, a podcast leader in developing shows to elevate local brands, local stories, and local storytellers. Cloudcast, bringing ears and minds home.
I'm Drew Schlossberg of Cloudcast Media. Always good to have back in the studio with us our friends from Fresh Start Surgical Gifts, and we have the Chief Development Officer, Michelle Pius. How you doing, Michelle?
I am really well. How are you, Drew?
Good. I trust the family is safe and healthy in this wacky COVID world we're in.
Wacky times, but we're all doing well.
Very, very good. And joining me is my associate producer of DS Studio, Connor Bain.
Hey, how's it going?
I'm doing just fine over here, and let me get right to it. So I know you folks have been on quite a bit. For those who have missed you in previous interviews, talk about the mission of Fresh Start Surgical Gifts.
So what we do is reconstructive and plastic surgery for kids that are in need. We're the safety net of kids that were going to fall through the cracks. They're uninsured, underinsured, don't qualify for a state-funded program, or if paying the enormous deductibles and co-pays would cause a financial hardship on their parents, we really recommend you call Fresh Start.
Right, and the website is?
www.freshstart.org.
That's how long you've been with the organization?
10 years.
10 years. And this is all free, correct?
All of our services are absolutely free.
Which is amazing, because I know over the years you folks have provided millions of dollars of free surgery for these kids, correct?
We have since 1991. We're actually coming up on our 30-year anniversary. Since 1991, we have helped over 8,000 children, and the value of the medical services that our volunteers have provided has just tipped $45 million.
Yeah, well, congratulations to you and the work that you're doing, of course, and those wonderful doctors and the nurses and the medical staff and the hospitals is just I don't know how you even describe it over here. Connor, I know you had a question for Michelle.
Yeah, well, how can kids become patients of Fresh Start?
We realize that with the pandemic and the massive unemployment it caused, parents started losing their employer-sponsored health insurance. So we recommend that they go to the website and make sure that their child has a condition that we can take care of. As I mentioned, we're reconstructive and plastic surgery. We also have ophthalmologists, ear, nose, and throat volunteers, dermatologists. So we cover a lot more than just cleft palates, which is what most people think that we do. So birthmarks, port wine stains, scars from accidents, disease, and abuse.
Mm-hmm. Yeah, that's what I was going to point out to you. It's not only from birth, it's also if they got in an accident as well. Is there an age group from when to when?
So we're pediatrics. So
Okay.
to enter the program, basically newborn to age 18. But a really cool thing about Fresh Start is you don't age out of the program. So when the child is turning 18, their parents don't have to become anxious about where their care is going to continue if they're a long-term patient. When we accept a kid, you're a Fresh Start patient until the best possible outcome has been achieved.
So that is just a great comment. And so you come in, you had your surgery at age 8 or whatever the case may be, and it's an intense surgery, so you're going to need care until whenever, as you mentioned, when the best outcome can be there. Could that be till 25? Could it be till 35? Could it be forever?
There are some kids. We do have one little girl that will probably be a Fresh Start patient forever with her condition. But remember, these are correctable conditions.
Right.
So we're looking at typically low 20s. Now, in San Diego, we're not as hard and fast on the rules because we are based in San Diego and from San Diego County. If you or your child is 18, 19 years old, and you feel there's something we can help you with, please just give us a call.
Right. Now, is there a waiting list?
There is,
but
it's a different kind of waiting list because we have 6 surgery weekend cycles during the year, which means we're busy every day of the year, but not every child will be at every surgery weekend. So we may have a child that we're going to schedule 6 months out,
right,
based on what their needs are and what surgeon is available. Now, we are stacking up the applications again, as I mentioned,
Right.
with these unprecedented times. I'm really trying to reach out to the community, especially locally, that the makeup of a disadvantaged child is different than what we thought of last year or even in January, where it was a child of a single parent who was working multiple jobs and they were living at or below the poverty level with no health insurance. Today, with all that's happening, it could be the family up the street. The dad was a mechanic, the mom was a teaching assistant, they got furloughed from their jobs, they're struggling to pay food and rent. So what I want to say is these are families that would never have thought they would have to seek out charity care. So don't think of Fresh Start as charity care.
Right.
Think of it as highly specialized medical care that you don't have to pay for.
Yeah, without question. We're chatting with Michelle Pius. She's the Chief Development Officer for Fresh Start Surgical Gifts. I'm Drew Schlossberg of Cloudcast Media, joined by Associate Producer Connor Bain. You bring up such an important point. We've been saying this actually for quite a while, probably since 2008. We're in our 13th year, believe it or not, doing the radio show, which we're real proud of. But when we had the recession in 2008, the person that was in need looked a lot different, than they used to in the past. This was the person that all of a sudden had a very nice job, but like most of us, you're not going to have 15 years worth of savings in, or a lot of us don't, and you're now making zero, and it's going on for 6 months or whatever the case may be. This is back in 2008. Fast forward to March of 2020, and all of a sudden, just right between the eyes again. And You're right, it's not who you think it is. And these are folks that have cared for their family for years and all that business. So that's a huge deal. Connor, got another question?
Yeah, I'm wondering how Fresh Start is able to provide these services for free. That's amazing.
It is really amazing, and that's thanks to the hundreds of volunteers that live right here in San Diego. So we have a very tiny staff at Fresh Start, and it's mostly for community and patient outreach, and the majority of our staff is on the medical team where they're coordinating with the doctors, scheduling the appointments. All of our surgeons, anesthesiologists, nurses, scrub techs volunteer for us.
Wow.
And they don't just volunteer for us once. I want to feel like we've never lost a volunteer. So some of our surgeons have volunteered for us for 15, 18, sometimes 20 years.
Now, are the surgeries done all over, or are they pretty much done here?
So we're the opposite of a medical mission. We bring all of the kids to San Diego, to our facilities on the campus of Rady Children's Hospital, and we do all of the surgery in the state-of-the-art ORs at Rady Children's Hospital. We're a partner with them.
Right. So does that mean you're flying somebody in from Florida or
Anywhere.
Istanbul or something?
If you are a child in need and live on this planet, www.freshstart.org. We're very, very well known outside of the country because the need is so much greater, especially because of the lack of medical expertise for some of these very complex long-term cases.
Right.
We take care of the transportation, food, and lodging. We do ask if you're coming in from out of state or out of the country, if your place of worship can do a car wash, pass the hat. But if that is not possible, we take care of your travel, food, and lodging once you're in to get you to San Diego, and once you're in San Diego. We have a lot of kids coming in from other states right now, and those parents have been able to. Everything is a Southwest flight away in the United States, so they've been able to put their $99 together and fly out here.
Right.
But once they're here, we take care of everything. We want this to be as stress-free as possible.
So do you work very close with our good friends at Ron Battalion House Charities?
We do. Our patient services manager, Lupita Morales, is a main contact.
Right.
When they have space, our families love to stay there.
Sure. Now, going to give a shout out to my good buddy Chuck Day. He's the president and CEO of Ramadan House
He's
Charities.
great.
Chuck's spectacular for more than one reason. He actually used to be at Rady Children's Hospital, as you know, development guy, and then became president and CEO, and has just done a marvelous job there as well. Before we go to break, I just wanted clarification on this. Not even a clarification, just to confirm. So they come in, let's say they're flown in from wherever the case may be, and they stay here, they get the surgery done, and now they're recuperating. Now it's time for them to go back to their home, whether it's in the East Coast of the United States or it's in Canada or somewhere else. How does the care continue when they're out of the country?
We'll coordinate with their existing physician. And then, of course, remember, some of these kids are long-term, so we have them coming back and forth. Some of the cases, they'll stay here until they're recovered, and then go back home.
Right.
So we try and coordinate so it's more like wound care, things like that are easier to coordinate in their hometown or home country.
Right. When we come back from break, we're going to chat more with Michelle Pius. She's the Chief Development Officer for Fresh Start Surgical Gifts. Find out how we can support their efforts in this unbelievable program. Was founded in 1991. So next year we'll be celebrating, if I'm doing the math right, their 30th anniversary. And I know, Connor, you got some more questions for Michelle when we return to another edition of Spotlight in the Community.
Cloudcast 180. Powerful people, powerful stories, 180 seconds.
Welcome to Cloudcast 180. We're here today with the president and CEO of Father Joe's Villages. Welcome to Deacon Jim Vargas.
Thank you, Charles. Good to be with you.
We have 3 minutes. Let's hit it fast and furiously. We're going to talk this morning with you about San Diego being a very expensive city, which creates a housing crisis, which is exacerbating the homeless crisis in San Diego. Let's talk about your leadership on this issue.
Sure, absolutely. We do have an affordable housing crisis here in San Diego. In fact, if you ask about the number one issue why people fall into homelessness, it's lack of affordability. And so they fall onto the streets, especially when rents go up, and rents are very expensive here. So we at Father Joe's Villages focus tremendously on housing. In fact, about 40% of our intervention is placing individuals into permanent and affordable housing. All right, so shows you the extent of what we do. And of course, there's services that go along with this, because in order for people to retain their housing, their dwellings, they have to have the services that they're necessary, whether it's mental health services or substance use disorder services, whatever that is. We have a Turning the Key initiative, whereby we'll be introducing 2,000 affordable housing units into the community during the next number of years. In fact, we just closed on a deal to purchase and refurbish a motel in the South Bay area. It's going to add 83 permanent supportive housing units. Next week, we'll be closing financially on a groundbreaking that will have 14-story building, 407 units of housing as well, taking about 550 people off the street. So housing is extremely important.
Which means you're investing a lot of capital. How are you finding that capital to solve the housing crisis in San Diego for homeless folks? 90
to 95% of our funding is public funding. Various sources, whether it be from the state, it be local, county, city, municipality. So most of it is public funding. There's tax credits that are involved there. The capital stack is quite large, actually.
So you're finding the land, you're finding the capital, you're changing lives. How are you minimizing the risk of future homelessness for these clients of yours? We're minimizing it through our services.
We need to make sure that in order for them to retain the housing, that they receive the services that they need, that are holistic and are comprehensive to their specific needs.
That's fantastic. Deacon Jim, in the last 10 years, your organization has taken 11,000 folks from homelessness to a home. So I congratulate you. Any closing thoughts for our audience?
No, that's what it's all about. And, I mentioned public funding, but at the end of the day, the bulk of our funding is philanthropic. And so I would encourage your listeners to look at an organization like Father Joe's Villages, who is effective in what it's doing, that helps those not only who are on the streets, but the community at large.
Cloudcast 180. Powerful people, powerful stories, 180 seconds.
I'm Drew Schlossberg of Cloudcast Media, and we are back with Michelle Pius, Chief Development Officer for Fresh Start Surgical Gifts, and joined by Connor Bain, Associate Producer of DS Studio. Connor, you got another question for Michelle?
I do. I wanted to, go a little more in depth with the post-op procedure. So, how involved is Fresh Start after the surgery takes place? Are you, keeping tabs on the patients?
Yes. So, it's white glove service all the way. So the only difference between the Fresh Start kids and fully insured kids is that they're not paying. Mm-hmm. So we have so many volunteers. Here's what happens. The child comes out of surgery and they go into the PACU, the post-anesthesia recovery unit. And there they're surrounded by anywhere from 3, 4, sometimes 5 nurses holding the parent's hand, making sure, fussing over the child. When the child is ready to be discharged, what we do is we have all the kids go to our partner Homewood Suites in Mission Valley, mm-hmm. and we have a registered nurse spend the night with them. They're not all in one room. What she does is she rounds on them every 15 minutes, just as though they were in the hospital. But there's no rest for the weary in a hospital.
Exactly.
And this way they're in a hotel. The mom can cuddle up with them. So all of the surgery is done on a Saturday. Saturday night, we have the volunteer nurse with the children. And then Sunday, we bring them back to the Fresh Start Clinic, which is up the street from the hospital. And they have their post-op visit. And then they are seen per the surgeon's instructions just like any other patient. I need to see you in 5 days. Stitches come out in 7 days. Everything is by the book. The only difference is they're not paying. And we also have speech therapy, and for the kids that have scars, if they're having facial surgery, we have lasers and other equipment, just like going to a med spa, to lessen the appearance of the scars, to break up the stiffness of the scars. Everything is included. And then once they're ready and cleared to travel, they can go home. And then if they're a one and done, say a child was cross-eyed, or we had a young teenager in from Florida a couple of weeks ago for gynecomastia surgery, and he was cleared to travel. He saw his surgeon post-op several times and was cleared to travel with instructions that their family physician can maintain, and he's actually finished. It was a one-time surgery to correct his condition.
Right. So how do people, folks listening to the show are going to go, God, my neighbor or, my cousin certainly can use this. Do they apply online, okay, and then how do they get accepted? Obviously, you can't accept everyone. If someone has a mole, I'm not going to sit there and do surgery for a mole or something like that, or maybe you would. I don't know,
It's, herein lies so typically Lupita and I do these shows together because I'll say yes to everybody, but she's on the medical side, and so she actually knows what the criteria is.
Right.
But
that's funny.
What it is we've made it a little easier so the mom or dad or grandmother doesn't have to fill out a 10-page medical form.
Right.
We have an initial inquiry to ask, what is your situation? How old are you? And we call and we do a welcome call and talk to you about what's up. And sometimes they have insurance. They just don't know how to basically get the insurance to pay.
Right.
Or they don't know that they qualified for Medicare if they're in the United States. So we do an initial call, and if it's something that we can manage, and indeed it would be a financial hardship on the family, we have them do a full application, because then they're going to have to request medical records, and then our medical team will have them, based on what our surgeons say, what kind of labs that they need prior to getting here to save time. Before accepting a patient, they may need to see x-rays, MRIs, or a CAT scan. And then all of the applications are put together as comprehensively as possible. And then every other month, we have a full medical program committee meeting. This is very structured. It's
Right.
not, Connor, are you available to do this cranial facial surgery?
Right.
All of the doctors, all of the cases are presented. We'll have all the doctors sitting around a conference table or now hanging out on their couch on Zoom.
Right.
And the cases will be presented and the physicians discuss the cases. And here's where it gets super unique. These are, for the most part, private practice doctors that normally would not collaborate with another doctor. They start talking about what they should do, talk about
That's
different
great.
opinions. And then a lot of times, like this teen that was out here from Florida, 2 of our doctors collaborated on the one surgery, and they learned from each other. Competitiveness and egos are checked at the door at Fresh Start. And so it's a really interesting
Dynamic. Yep.
not only for the children and the parents, but the volunteers feel like it's fulfilling a need for them. And one thing that I learned, and it was a question from somebody I was taking on a tour, we had a visitor to one of our surgery weekends, and that person asked one of the nurses, so when you volunteer for a Fresh Start, is it the same job you do at Rady Children's Hospital during the day? And she said, no, that is why I love volunteering at Fresh Start, because I've moved up into management, supervisory roles. This gets me back at the bedside, which I miss and I love.
Yeah, no, that makes all the sense in the world. We're chatting with Michelle Pius. She's the Chief Development Officer for Fresh Start Surgical Gifts. I'm Drew Schlossberger, Cloudcast Media, joined by Associate Producer Connor Bain. So what can our listeners do to support your efforts?
We could use some financial help.
Okay.
With all of this,
Right.
we are getting scores of applications every week. Your money is put to its highest and best use. So sometimes with, say, take a food or clothing drive, you could collect 1,000 cans of food. You can collect 1,000 articles of clothing, which are super, super important.
Right.
Don't get me wrong. I'm just using this as a math example. If you have 1,000 items you've collected, that's basically what you can distribute. But because Fresh Start is leveraging the actual cash cost against the donated services of the physicians, of the facilities at the hospital, $1,000 can be turned into $5,000 to $6,000 worth of medical care.
Sure.
So your $10 goes very far. It becomes $50 or $60. It's Friday. We could do a little $5 Friday fundraiser, and everybody can get involved. I know, Drew, several weeks ago, we talked to Ariella Pacheco, who decided to make dolls
Unbelievable
for
interview.
the kids.
Unbelievable. What a superstar. Yeah.
And you want to know what's even nicer about that? Another woman in Carmel Valley called and said, my husband and I are stuck in the house. She started Ariella and her exchange sewing tips and patterns. And this woman, Karen, and her husband are making not only dolls for the kids, but he's making little furniture for them too. So everybody can get involved in a way that's meaningful for you. If you have a little extra money in your wallet, we're always happy. The kids love coloring books, dolls to play with. We can always use backpacks to put all of their gear in. So there's all kinds of ways.
Now, is that on the website? So if it says here things you can donate, or not on your website?
It's kind of call Michelle and talk to me about it. The other thing that
Call Michelle, right?
I'll give you my direct line, 760-448-2018, or michelle@freshstart.org.
That's wonderful.
Let's talk about host families, though. I want to say, next to medical volunteers really feeling good about what they're doing, host families cry when their parent and child leaves that they've been hosting. It's a great way to meet people and show off everything that San Diego has to offer. And for kids that are going to be here for a couple of months with their mom or their dad, sometimes it's the grandma that travels with them. Being a host family is an invaluable way to help Fresh Start and also enrich your own life.
You know what I'd love to do is, unless it breaks HIPAA rules or breaks whatever rules and all this, I'd love the next time you're on, because you're not passionate enough, is to maybe bring on a host family that has done this before and talk about their experiences and get other folks to get involved. Michelle Pius, always good to see your smiling face. I'm glad we're doing this in studio. What you folks have done since 1991, you just can't even begin to explain this. Come back soon after the first of the year, promise me, and bring in a host family.
I will.
Right? Okay, very, very good. Wishing you and your family nothing but a safe, healthy, and restful Thanksgiving holiday.
It'll be just the three of us, boring, but I've made a menu that would feed an army.
Good. Connor and I will be over for leftovers on this.
That's a good Thanksgiving.
Just beep and we'll toss it to you from the porch.
That sounds good. Michelle Pius, Chief Development Officer for Fresh Start Surgical Gifts. I'm Drew Schlossberg of Cloudcast Media, joined by my colleague Connor Bain, Associate Producer, as you're listening to another edition of Spotlight on the Community.
Thank you for listening to a podcast from Cloudcast Media, the digital media home for leading local brands. When it comes to amplifying your brand, a Cloudcast-sponsored show offers unbeatable value. Learn more at cloudcast.us.